Welcome to the Better Never Ends podcast. We've made it our mission to share with you the expertise and wisdom of role models and leading experts in their field, teaching us about how we can be better, telling stories about their journey to better, inspiring you to discover yours. I like to do my research on guests as they are coming in, just have a look at what they've put out there into the universe. And this particular part of research is very relevant to our universe. And I just want to talk through or just read off what I found. Okay, here we go. We are all extremely small dots in an immense universe, passing through in a flash. Knowing this gives us a different perspective, what really matters. Clarifying this and focusing on it each day, living what really matters. The rest can just be left. Doing this, you realize there are just a few things that really matter. You take responsibility, which means you can respond, and you have choices. That's freedom. Responsibility gives you freedom to be the dot in the universe. When you contemplate that, how do you feel? And it really got me thinking, actually. Yeah, that dot concept. So Richmond Stace, here you are.
Yeah.
Thanks for coming in.
Good to be here.
Let's go straight in there. What prompted that? What are you eliciting? What are you trying to fire up in someone's mind as they read through that very poetic piece that you wrote?
Yeah. Did I write that?
It seems to be you.
I did write that. Do you know what? I sit around reading and thinking quite a lot. I've got that luxury. I'm lucky to have that. But there's a purpose behind it, because I'm looking for as many different ways to help people to look through different lenses at their life situation. And that one came to me, I think I'd been listening to a bit of Sadhguru. I can't remember why the universe thing came about, but it's a familiar idea. It's a familiar concept that I've had. This sort of feeling of awe when you're standing somewhere looking out, somewhere vast, or just looking up at the sky, actually, or the stars, or whatever. I know it always sounds a bit sort of magical and mystical, and I think some people, what's that got to do with pain and things like that? Well, pain's always to do with the person and the perspective they're taking in that moment in many ways. So being able to have that sort of option available where you can be aware of how you are, and that takes some practice to get to that point, obviously. But then you've got this option, you've got this space. I don't mean space, outer space, but you've got space to now think, okay, well, I want to be in control here as much as I can of the things that I can control. So this is a useful way of thinking about it. And the reference to responsibility, when you think about the word, you've got a response and you've got ability. And I quite like breaking that down. It does trigger or tweak some people when you sort of say this, because, and I get it. They say, "Well, what are you saying? I'm not trying hard enough, or you're blaming me," that sort of thing. No, it's not. It's not about blame. It's about trying to see things as they are. And we are these little dots on this amazing planet within something that's so vast, it's difficult to really comprehend. And I'm no Brian Cox, I don't have much knowledge of those sorts of things, but I have the experience like we all can. And it just seems by taking that sort of perspective, it can give you a nudge, because undoubtedly there's a lot of suffering that comes from focusing on oneself. And I don't mean that in the same way as focusing inwards in terms of inner engineering, that sort of thing, or the way out is in. I just mean that self-focus. You have to be focused on yourself to be in pain, to be depressed, to be anxious. Because as soon as your focus goes outward, then things change. But of course, that outward's being generated from within.
Yeah. When I read it, it really made me think of the vastness and therefore the impossibility that here I am. There's almost a gratitude that came to me, and I'm very interested in space. So it's not an unusual thought process for me, and I think that's why it appealed to me so much. It's I love this kind of thing, this thought that takes me on a journey through space and then back again into myself. That is, the finishes with a gratitude that here I am and how lucky I am that I get to experience where we are and this planet. So I I guess it can be perceived however you perceive it, and yeah, there's certainly a big drive of gratitude that I feel from that. And once you have that gratitude, perhaps that can also spark a desire to be self-compassionate to a level that maybe some struggle with as well. And this was, I read through a few pieces of your work, and there is a really nice thread to it all. It's thought-provoking without being kind of in your face. So yeah, I quite like that. So we've already introduced who you are. Tell us a bit about what you do on a day-to-day basis. What is it? What's your role? Who are the people you see? And then maybe if you can follow that through with why is that interesting to you?
Yeah. Wow. Well, you know what? Each day is, it sounds so cliche, each day is really different. And it is. You know, when I look at my day today, for example, I did an online session with someone this morning. I then went and visited someone in a residence and did some work there. This afternoon, well, now I'm here, and then after that, I'm going to do something else in a completely different sort of scenario in this evening. And I guess the thread is I help people who are stuck. I mean, yeah, largely with pain, but they're suffering, and there's all sorts of reasons, and the complexities of pain reach out into what I would call a lot of non-pain. And that's quite a Buddhist sort of concept that, you know, whatever we're thinking about is made up of non-that. So a flower is made up of non-flower elements, and conditions. So let's look at those and see, well, what are the true causes of suffering? What are the true reasons for this person's pain? And then helping them to understand that as the first step, and then getting into skills. So it's very practical. That's why I call it pain coaching, because it's about that person. It's about their needs. It's about what they want to achieve, their goals. And as far as I can tell, pain's asking for that shift to meet those. Because when you listen to people's stories and their narratives, you realize that they're not meeting their needs and they're not working towards their goals. They're stuck. And there's all sorts of reasons why people get stuck. So I guess my job or role is to help people to understand the nature of it, the true nature of it, and then look at the practical ways of moving forward. And I journey with them as long as they need. But ultimately, it's about transformation. You know, to transform pain, you've got to transform your life. There's no two ways about it. I mean, there's no quick fixes, there's no hacks, there's no medication, there's no interventions that sustainably transform your pain, because it's about you and your life. And keeping that bigger picture and understanding that is fundamental.
And one of the tricky parts for most people is that they have experienced pain many times before, and it'll be related to their tissues. They'll have some level of tissue damage. They'll have an injury of such that needs a normal amount of time of rest, and then a gradual build up back to activity. And on average, things work that way, and the pain will naturally recede, and they go back to normal.
Yeah.
And their memory then is that pain was telling me to stop. I stopped. When I got back going again, it felt kind of okay. And if my pain hasn't stopped, that means I'm not okay.
Yeah.
So people have this very understandable and rational belief that their pain is telling them to stop, and therefore they are stuck.
Yeah.
So tell us then how you help someone see things differently in your world. And we have a lot of physios that listen to us, and we have a lot of non-physios that listen to us too. So we're speaking to both communities here, right? But I think if we explore it as if someone is in this situation, how do you then shape that conversation?
Yeah, no, it's a good question. I mean, first of all, I tend to dissolve because we might be coming from slightly different angles and such like, but the vast majority of us are going to experience pain of some kind. And just as you describe, a lot of people have acute injuries, or there's perhaps more obvious reasons of pain because there's a certain inflammatory condition or autoimmune condition or post-surgery or whatever. And they have that pain, and it's treated in various ways, various sort of traditional ways. It's thought of in a very sort of traditional way, and indeed it gets better. But that doesn't mean that something like the biomedical model is explaining it, because we've got these millions and millions of people who don't have that experience. In other words, experience ongoing pain. So yes, pain can be about you need to look after yourself because you've just got an injury or whatever it is. And I would always argue that pain really is a part of that. It is a protective device. It's a survival mechanism, and it is asking you to look after yourself. I often call it a need state, like hunger or thirst. But when, of course, there isn't something obvious to explain it that's anatomical or pathological or such like, or certainly not sufficient to explain the impact of that pain or the severity of that pain, we need something much wider. So when you understand that pain's always about the person in their lived world, and it can't be reduced from that, of course. You can't reduce pain to a rhythm in the brain or a pattern in the brain or some fancy coloured picture of the brain or a nerve or a receptor. Because at the end of the day, none of those things have the ability to generate a pain experience. People go, "Well, but that's where I feel it." Take back pain. I feel it in my back. Yeah, you do. It's real. I always emphasise that point, even if I think someone understands it. Always make the a big deal of, no, your pain is real, and it is embodied. You're feeling it in your body, but it's not being generated from where you feel it. And some people get that. Actually, I'd say that these days more and more people kind of roll with that.
I agree with that.
Yeah. But still, you get a like, what? Actually, I'll probably get more of a what from healthcare professionals. I think of the body tissues, nerves, tendons, ligaments, what else? Cartilage, bones. What else have we got? Fascia, skin. None of them have the ability to generate a conscious experience. So if I've got knee pain, there's nothing in my knee that can generate pain.
Yeah, the phantom limb pain really helps often with this. It's just drawing that parallel, and people go, "Oh yeah, I know that's a thing."
Yeah.
And okay, right.
Yeah. And it's having these examples to hand as a clinician or practitioner, having these examples to hand, because we're having these very important, caring conversations with people, which can easily go wrong. There's a lot of unintended harm through the wrong messages, but also the wrong attitudes and approaches. So we need to be making sure that the person is really clear, and that's quite challenging. Because it means that we as the clinician and practitioner have to have a really good understanding, because only through that can we then communicate it. So then we have to have good communication skills as well, or perhaps great communication skills, setting the scene. And with the pain coaching, that's always been a big part of it, is more and more people call themselves pain coaches now. And one of the key elements of it, I would call the spirit of pain coaching. And I've kind of nicked that from motivation interviewing, because the big part of it is the spirit, the approach, the unconditional positive regard, the accurate empathy, the being present with that person, the rolling with the resistance. And in fact, you need the resistance, because that's where the work is. So the spirit of pain coaching very much embodies those things and other things. So your way of being. So when I mentor clinicians, a lot of it is around your way of being, because the interventions, they can be important, but they're never going to be that important if your approach isn't right. And each time you meet someone, each time you're with, even if you know the client or patient and you've worked with them for a while, each time you meet them is new. It's a new time. You're both new. So the sort of the spirit of the beginner's mind from Zen, I think, is really important. Because if your cup is full with knowledge and models, and you're purporting some model, because of course there's no single approach for pain. There's no this for pain, that for pain, because that's assuming that everybody's the same. We need to meet the person where they are, and that will be different. I mean, that could be different within the session, let alone between sessions.
Yeah, I get that. I get that idea a lot, and I get that healthy resistance in sessions a lot, because we'll have an initial conversation about just shaping someone's change of mind about this pain belief, where it might be coming from, and then nodding along like, okay, I get the cognitive side of this, the understanding is there, but what we're going to do about it. And they get that kickback of, okay, so what now?
Yeah.
And then, as you quite rightly said, there is no one universal treatment. There are different ways of approaching it, and it's a dynamic process, and it can be one thing for one, another for another, and it emerges gradually, I believe, over time, and it's shaped by that person's belief, where meeting them where they're at. And that's a tricky thing, and I think that's what you're getting at there with, it is how you turn up to these sessions. You have to be ready to roll with the punches, roll with these situations and see where it takes you. You can't just turn up with this premeditated session to say, here's my one fix for this, because it just come back to bite you.
Yeah. I mean, there's a lot of talk of personalisation and personalised care, and but when you look at it closely, as soon as there's a sniff of protocol, that's not personalised. So it needs to be principle driven. Take exercise. And exercise is important. And of course, that encompasses a whole range of things, from specific rehab exercises through to just generally being active and such like. If you're just sort of giving a list of things, and you've been through them with your client, and you're giving them a list of things to do, and it's 10 by 3 or 10 by 2 or whatever, to me that's not personalised, because they'll go away with that, and anyone could go away with that. Whereas if you teach them the principles of working within the window of tolerance, for example, and bookending it by preparing themselves just like a elite athlete or peak performer, and learning the skills of being present so that they know what's happening as it's unfolding, so they can tweak and adjust accordingly, and then at the end of that, review it, acknowledge their success because they've done it a particular way, have some recovery time, perhaps using breathing or whatever. Now it's personalised, because they're deciding what they do according to their needs in that moment. You're not with them. They're with themselves all the time. Most people are awake 15, 16 hours a day. That's over 100 hours a week. So certainly with something like persisting pain, chronic pain, things that are more complex, giving someone a few exercises will probably cover what? I mean, if someone says they do an hour of exercise a day, you're like, wow, that's good going.
Yeah.
So not many people do that. Most people spend 10, 15 minutes. That's good. That's good. What about the other 100 hours a week? How are you living? And that's the bit that's often missing. And commonly, patients and clients, when you first talk to them about it and get things set up so their expectations and realities are now aligned, these are really important conversations to set the scene. Because if they're thinking that doing a few exercises a day is going to solve the problem, well, they're going to be disappointed.
Yeah, I think most people, by the time they reach someone like yourself or even me, quite often, is that they've probably had that already. They've probably had exercises to some degree, often very good quality exercises, and they're still turning up with a problem. They're still stuck, to use your language. And what I really like, just drawing back before I miss the opportunity to draw on this, is that you were discussing coaching, pain coaching very specifically.
Yeah.
What you're saying there about this mentality is that you're providing them with the tools so they can solve their problems, which is absolutely a coaching philosophy. And this idea that we may be the experts within our professional field, but they are the experts in themselves is very aligned with coaching.
Yeah.
It's allowing them to use what they know they are expert at, combine the two concepts, our expertise, their expertise, and you roll with it there.
Yeah.
And then we move into this exercise plus the rest. So let's talk about the rest.
Yeah.
So tell me about some of the other things that you often would discuss with your clients who are stuck.
Yeah. I mean, it depends on them. It depends on them. I'll give you an example. I get to know them. Forming that bond, that creating this. I call it the caring crucible, because you're in it together, just as you described. So I like to get to know them and what they're into, because we use that. I use the phrase "living yourself better," because there's this whole bulk of time where, what's working for you, what habits do you already have, what patterns are working for you. So we reflect on that, and then what isn't. What kind of thinking is holding you back? Where are your limiting beliefs here? They have to be revealed. And that all comes in the conversation anyway. I mean, it can be quite a direct sort of question, I suppose, sometimes. What do you believe is causing your pain? Why do you think you're not getting better? But obviously the tone and the approach and the rapport you have matter when these questions come up. And they provide you with everything you need. As you said, they're the expert in their pain. They're the expert in themselves. They're the expert in their lives. And we need that. And we work with that. So yeah, we bring along various ideas, a whole gamut of tools and skills and so on and so forth. I mean, there's endless. And I see our job as offering a range of things, and then together, because ultimately they'll choose. They're autonomous. They're going to decide what they do in their world. We can't. The idea that we motivate people, I think, is a bit dubious. What's their drive? And you might get into that. What really matters to you? Well, I really want to get out more. I spend a lot of time at home worrying about going out. Well, why do you want to go out more? What exactly do you want to do? And through that, it just starts to unfold, and you might then say, well, what are your concerns? What's really holding you back here? What do you think is going to happen? And they'll tell you. You say, well, how do you feel now thinking about that? Because you're living it, aren't you? Because as soon as we think about something, we're living it. Oh, well, I was working with someone earlier. There could be a lot of people. I'll have to deal with a lot of people. They might bump into me. Like, well, yeah, that's true. Because they could. So you sent someone in London or whatever. They could bump into you. Okay. Is that enough to stop you going out? How could we look at that? So I use the I.C.A.M principle. It's fairly straightforward what that means. Focus on what you can do and start there. Because often what people do is focus on what they can't do. I really want to go for a coffee with friends. Okay. Well, when are you going to do that? Well, I can't do that because, I can't do this. I can't get there. I can't. Okay. Well, let's look at what you can do and build from there. So that could be a whole range of things. But yesterday with someone, they enjoy tennis. So we just created this little kind of movement-based practice where they were watching the tennis, and as the receiver got the ball, if it was forehand, they'd shuffle to the right, and if it was backhand, they'd shuffle to the left. And then they start imagine playing the shot. So I do use a lot of imagery and visualization work with people on that basis, that what you're focusing on governs how you feel. And if you can generate those feelings, particularly positive feelings of excitement or satisfaction or joy, or now you're starting to get the wheels turning in the right direction.
We've already covered some of these ideas of the complexity of communication here and the necessity of accurate, high quality communication. What's your sense about how that's taught to physios in general?
Well, I can reflect on my own experiences. So I'm multidisciplinary. So my initial training was a nurse, and we did a lot. We did a lot of coaching, actually. When I look back, did a lot on education with patients, spending time with them in different ways. I always remember, I often talk about this actually. A notable training was when we were taught how to shave a man's face. Incredible detail. And yes, you want to do it well for them. There's nothing more annoying than, I don't know if you've experienced this, you shave in a bit of a rush, and then you go out and then you just sort of touch your face and you realise you missed a bit.
Well, the watchers will notice the baldness of my head, so I often feel it, actually, the back of my head.
Yeah,
I missed it.
You're like, yeah. So someone whose agency is limited because they're in a hospital bed or hospital ward, and you're there, but it's also bonding. It's also a way to get to know someone. So I see that as a form of communication as well. But apart from that, just through my own interests, I got into motivation interviewing some years ago, and that's something I consistently work on, and I still go and do the workshops, and because you can never stop learning and developing that skill. And I always encourage people to do that. I think it offers a huge amount in, as I talked about before, both the spirit and the technical side.
I don't necessarily think that these courses have an entire responsibility to solve all of our problems as a student. But I think really, as you reiterate there, is such an important skill that physios should be looking to consistently and deliberately working on is communication one way or another. I think there's lots of ways of doing that. And my way actually is this podcast. So one of my ways of improving my ability to communicate was hosting. I'm not sure it was my sole ambition and reason at the start, but it's certainly become a good reason for me to carry on. Is I know that my communication has improved since.
Yeah.
I'm sure other people have lots of different ways of doing that, but unless you're being intentional about it, I imagine that those communication skills can remain stagnant and ineffective in lots of cases.
Yeah. Yeah, no, absolutely. Absolutely. And I have actually been looking for various reasons at undergrad communication, as in what's on the courses, and chatting to a few people. They didn't really know my background, so it was quite nice just to sort of have a bit of a chat and see. And I don't want this to sound as a criticism, but my feeling, it probably will sound like a criticism, it's an observation where we need to, I think, improve, because I think that communication work should be a strong theme throughout, because I just think we're in a human game here.
And we're in a digital world. I think that's the other part, is that much of our communication now is done without voice. It's done without talking. And that has no doubt improved our connectiveness to some degree, but it's also disconnected us from the verbal part of our communication, which is the vast majority of our job.
Yeah. And being able to have a conversation with someone. So my observation was that there is communication in the syllabus. But there didn't seem to be the understanding or the depth of understanding that I would think would be necessary right from the word go. So I think that even before starting on a physio course, that should be something that's looked at in different ways. In schools, where are the lessons on communication and relationships
of it? We go back to the universe. There is a universality of communication being important in our world. I just sense that not enough importance is put on to it. I agree. From a young age.
Yeah.
And I guess that doesn't solve the problem necessarily, but it draws us to continue to work on this stuff throughout our adult life. And some of that, if we can almost look at when it goes wrong, some of those issues with when communication goes wrong, some phrases relevant to the pain world, like you've just got to live with it. That's something that highly specialized consultants will definitely be guilty of.
Yeah.
Saying to patients in pain, you've just got to live with it. You've just got to get on with it.
Yeah.
How do you unpack that for someone who comes to you and they're saying, what do I do with this? How do I manage that?
Yeah. It's really common, actually. And I would say more common in women who are suffering have pain. There's a lot of issues still about not being heard, being dismissed, not taken seriously. Men as well, but particularly women. It's something I'm focusing on a lot at the moment. And I position it that it's a colleague or fellow professional is doing their best, but they're doing it from a limited viewpoint. They clearly don't understand pain. That could be quite a controversial comment, but they don't, because they wouldn't be saying that if they did understand pain. Because if you understand pain, you know there are possibilities. If you don't, you'll think there are not possibilities, bottom line. So this is unintended harm. They're trying to help by saying you've got to get on, just do this or just do that, and that word comes up a lot. It's just this, it's just that, just do... No.
Yeah, it's belittling.
It's belittling, it's demeaning, it's not taking it seriously. And, these people then go off back into their world in pieces sometimes, and that healthcare professional goes off in their world. Their two worlds are probably quite different. Certainly in some cases, and I always find that very difficult. It's a difficult one, because it evokes quite a strong emotion, because it doesn't need to be that way. But in terms of what you're asking about, then how do I work with someone on that? We have to acknowledge where they're at on it. We have to acknowledge that there's, if you like, inter-trauma going on there. So someone's already had something happen, could be an injury or condition or whatever, and then they're just having these sort of continued traumas some bigger, some smaller. Each time they're confronting a challenge, each time they have another consultation that is perhaps unintended harm, or they've got some expectation and it's not met. And there's any number of varieties of that. And it just keeps going. And some people just end up seeing so many different people. But from the perspective of someone who's experiencing pain, they wouldn't know where to go.
Well, there's also this desire to be fixed, that they're looking for a healthcare expert, understandably so, to fix their problem, to solve their problem, which, as we both know here, is the wrong way of looking at it. And I like this idea you brought up earlier of a need state, like hunger, like thirst. When that need is met, it's quenched. And if we can help them believe in that, then there is hope.
Yeah.
I'm a big believer in the first session to send them away feeling hopeful.
Yeah.
I've got enough evidence in my caseload to say I've had enough cases that get better from this to believe that you can be one of those.
Yeah.
I haven't used this before and drawn on this idea of a need state being met, that your protective system, your pain system needs something and we haven't yet figured out how to meet it.
Yeah.
And that's our journey.
Yeah. It's just not the need that they think it is.
Yes.
It's not the need of, some tissue or some disc in the back or whatever. I mean, even if there is an injury with those things, the needs are still far greater than that. That will heal in the best way if you create the best conditions. And that's under your control as an individual. There's a lot of meddling and fiddling and things that are done to people which would potentially disrupt. Look at taking anti-inflammatories early on, for example, But lots of sort of injections and interventions, and they say this sort of thirst to do that. And we just need to be much more judicious. I'm not saying there's no role, but much more judicious, because any of those interventions, whether it be medication or injections or indeed hands-on therapies or acupuncture, or whatever it is, they may help in the short term, but only ever be short term, because there's no transformation. The systems have learned to generate that pain under certain conditions. So if you're in pain, and even if it's familiar pain, there are certain conditions mean that that's what you should feel. So I often say, when people sort of start looking at me and I go, okay, if you got some eggs, flour, milk and sugar, put it in a bowl, mixed it up, stuck it in a tin, put it in the oven, what do you get?
Cake.
Get cake. Someone said something odd once. I can't remember what it was now, but it wasn't cake. I was like, okay. Anyway, what you don't get is chicken pie. So you've got to change the conditions, right? And then you could get chicken pie. So what the individual, the person experiencing pain, is doing when they're getting better is they're consistently creating conditions. And if you follow the insight of focus on what you want rather than what you don't want, it's very interesting that we as humans tend to focus a lot on what we don't want. A lot of things we don't like, and so on and so forth. Well, focus on what you want. What life do you want? What do you want to be doing? And what steps are you taking every day to follow that path? How are you creating the conditions for that to happen in your day-to-day living? What changes have you made? So when people, they try things for a few weeks and then say, I've still got this pain. I say, well, what changes have you made? Well, I do a few exercise things. Okay, well, what about the rest of the time? And these are sometimes the prickly conversations. I'm not always asking it in the same way that I'm describing it here. I'm being quite brief. But until the person realizes and essentially awakens, becomes more aware, and this is why being present is, to me, fundamental. Life is just this moment. A life situation spans over a period of time, but of course the past is gone, doesn't exist. The future is just imagined, doesn't exist. But if you're living now as if those things are happening, where you're not actually present to either look after yourself or to take the step in the right direction. So to me, it's a fundamental skill, and it's something that we look at. it's no different to gardening in a way. You create the right conditions and ally that with focus on what you want rather than what you don't want in practical ways. You can't treat pain. There's nothing to treat. Oh, but I've got pain in my knee. Okay, well, where is it in your knee? Well, it's there. Well, what's there? Well, the cartilage or something. Obviously, it's probably not the best example, but it's something in there. Well, where in there? What part of the cartilage? Say they've gone with that. I know it's not accurate. Where? Well, the cell? Well, where in the cell? I mean, you just keep going. There's nothing to treat because pain is made of non-pain, just like a flower is made of non-flower. So what we can control and what we can do to make a difference and get better and transform is to keep consistently creating the best conditions. That means all the healthy practices, the skills of being well, meeting needs, working towards goals, all that stuff, finding meaning, purpose, being present, and so on and so forth. None of it is complex. It's all pretty straightforward stuff.
However, pain demands our attention, and you can see why people get stuck in this process. I had this metaphor in my mind as you were talking there, it's just growing of this the pain being this fire that's burning within someone, and this pain in this fire is demanding that they put it out. And you can sense how someone would have this urgency towards someone or themselves putting this fire out. Mm-hmm. But every time they put the fire out, the conditions are such that the fire comes back again.
Yeah.
And the fire keeps blazing, and they're not looking at why the fire keeps happening. They're just thinking, there's a fire, I need to put it out. So the alarms are going off, the smoke alarms are going off, and they're demanding that we put this out. A couple of things we can look at there is the conditions, as you say. Are there any conditions we can change that will stop the fire happening in the first place? And is the alarm just too sensitive? Is it really just burnt toast and it's overreacting, oversensitized to the environment? So, and I sometimes will use that kind of smoke alarm analogy with people. But yeah, this idea that no wonder people behave the way they behave because there's a fire.
Yeah,
and they need to act, and they just haven't yet been able to work out the strategy for that. They haven't learned to look at another part of that situation. We also have, I picked this up on another piece of your work earlier, is that the scan culture that we have, we scan everything. Certainly in private practice, scans are used a lot. Once you see it, you can't unsee it. Very difficult to deal with that. And as your provocative picture said, can you smell this picture?
Oh yeah.
Yeah. So you had this picture of a fairly normal looking quarry, I think it was, or something like that. Tell us what you meant by that. Can you smell this picture?
Yeah, I know where it is. It's a little harbour, and when the tide is at a certain level, it stinks. But just looking at that picture, you'd never know. It looks pretty scenic. You can't see an experience. You can't see pain. It's unique. It's unique to the person. It's real. It's there. It's unique to that moment. And just going back to something you said before about it demands attention. Yeah, absolutely. Maybe it's one of the biggest things that demands our attention. It can be very, very intense and difficult. And I think that's an important point to make, that these are challenges for people. It's really hard. But the caveat to that is, the more you're thinking it's hard, the less you're focusing on what to do about it. So there's these little insights, I call them the catalysts of change, because when people get them, it just makes such a difference to where they put their energy. Because if you're putting your energy into the living yourself better as much as you can, you'll always go off the path, we all do. Then they're going to be on the right route. But they also need to understand that you don't know how long it's going to take. And as soon as you start asking that question too much and looking for the answer of that, again, you're off the path. How long is it going to take? I mean, it's a totally understandable question. I get it. I would have the same question. And I posted something about this the other day. It's not the right question. The right question is, what do I need to do now? Because now's the only moment. And that fire analogy, yeah, I like that. That's, this sort of sense that there it is, and then you change the conditions to some degree, and there it is again, but different. So impermanence, I think, is a really important principle for people to understand as well. Things are always changing, which can be difficult to get your head around in some ways because it doesn't feel that way. That's not how things appear. That's the thing.
It feels like the cartilage in my knee.
Yeah, it does. And then you realise it feels like that because of my narrative that I believe. And that's the cage, is that narrative, which is also demonstrating sticky beliefs. So all this stuff that comes up is really useful information for us as the clinicians, because then we can examine it. And so sometimes, the work is that. It's examining these beliefs and updating them. And what's interesting is that when you do that, or they make some kind of shift, which is what pain is asking, the way they move, the way they breathe, the way they speak, everything starts to change because they've changed state. I don't always realise why they've done it, and you have to sort of point that out so that they learn, because it's, as I was saying earlier, it's the principles. They need to do it in their world as well, because that's really powerful when they start realising.
It also takes, by guiding them towards some of these the other part, the non-pain as you describe, it takes them away from just trying to extinguish that fire, putting out that fire, to change the environment. And we know through some of the work, I quite like the Steve Peters concept of the angry chimp inside of us is demanding our attention. The more you feed the chimp, the more it's going to keep shouting at you and screaming at you. When I read that book, I read it as pain. I read it as that's what happens when pain is given too much attention. It just runs the show.
Yeah.
The fire, if you keep feeding the fire, it will just keep blazing.
Yeah, I mean, look, attention seems to be a bit of a volume switch. Whatever you're putting in, and we're only aware of some really small amount. Our focus is very narrow, and then we've got sort of stuff around us we're vaguely aware of, and there's a lot we're completely unaware of. I suppose I'm always a bit wary of concepts, and because a concept gets in the way of seeing things as they are. If you're looking at a tree thinking, oh, there's a tree, you're not really seeing the tree. You're thinking there's a tree. And I know that some of this stuff can sound a bit weird, and be like, well, who cares about that? It's just a tree. But concepts are not the experience. And this is where we can easily get caught up in the sort of the science of it, or the explanations. The clearer that someone can see, the more the possibilities, because fundamentally you're present. And I don't know, this might be a stretch for some people sort of listening and watching, and I suppose I'll just point out that there's a build to this sort of thing. You're working with someone to get to the point where you're working with ease, or at this sort of level. But actually, some people, you may not need to work at that kind of level. It may be that the updates in the systems come through just some better understanding and realizing that they can do things, and they just sort of get on with it. So the depth that you go to on this varies enormously.
I've had that. I've had people, very rarely, but I've had people who have had pain for a very long time leave the session without pain, and they've been fine.
Yeah.
So it's a rare situation, but it's a real one.
Yeah.
And that just shows that they just needed quite a small belief shift, quite a new bit of information they hadn't considered before, and off they go.
Yeah. Oh yeah, absolutely. And that's the basis of perhaps meditation and psychedelics, of just giving the nudge. Another way I often describe this is that if you think about your body systems a bit like a firm plastic mold. So kind of whatever you put in the mold, call it jelly. Whatever you put in, the same kind of things come out. Now, it's not always the same. It can't because of impermanence, but it's sort of similar. So their experiences are similar under certain situations. And the systems have got used to generating that and predicting these experiences. Boom, boom, boom. So anything like a time before, they're There's something there that's like a time before. What was it like then? This isn't your own dialogue, by the way. This is your sort of systems working it through statistically. Yes, boom, that can be enough to generate a pain experience, because we've had this before. Expectations, past experiences come through to the present until updated, until we can create something new. So what we're doing there is we're taking the mold and we're warming it up. Call it entropy. You're warming it up and then you're reshaping it. So now you've got new experiences, better experiences. So you get better by getting better and by curating, and this sort of ties in massively with the personalisation of the exercises, the practices, the skills, the tools, because they become the curator and creators of what they're doing to get better, because what you do now shapes what will come. So everything's form of practice. Everything we do now is a practice for what will come. Like pain, not pain, whatever. It's just learning and growth is fun, and change is fundamental to life and being human. If you bring awareness to that and consciousness to that, then wow, you can really be the engineer of your states, joy, compassion, love, or inspired, all of these high energy, elevated emotions. Now, you're not in those states all the time, obviously, but you learn to be more present so that you recognize when you're out of those states and you're able to shift back into them.
And if you're stuck in past beliefs, then that predictive model is predicting how you were before, and it's holding you back. So that then shapes the necessity for the being in the now and changing the narrative. And I picked up on the word prediction earlier. You mentioned it just a brief moment ago. I came across this probably maybe 6-7 years ago, and the idea was interesting and confusing at the same time. Can you help our audience understand what you mean by prediction?
So PP, predictive processing or predictive coding, it's been around for a long time, actually. You see it a lot more now. You hear people talking about it as if it's something new. So, the guy who arguably brought it into pain was Mick Thacker, who I've known for many years, a friend and a mentor. He's been a huge guide to me over the years. So he was talking about it and we were talking about it. I don't know, it's got to be 20 years. A long time. It emerges from a whole range of fields. But it's a really interesting way to look at things. And arguably the best way to look at pain. It's really talking about the generation of our experiences, all experiences. I sometimes wonder, is there anything special about pain? I mean, it's horrible. We don't like it. But is there anything special about it compared to anything else? Why do we put it on a pedestal? Why are we making it into a big deal? And by the way, that doesn't mean we're demeaning it. Just why are we putting it above everything else? How do I want to feel? What do I want my systems to be predicting? So, as it goes, essentially what we're saying is that all experiences are predictions. They're best guesses to explain the possible causes of the sensory information coming in right now, but based on prior learnings. And if things turn out the way we expect, because the world turns up the way we expect it to, and it turns up as we are, not as it is. So everything out there, we see each other here, we got all this stuff around us. We're kind of seeing it because we know what these things are, and we expect that. There's nothing unusual that happens. But when the world or life turns up in a way that we don't expect, that's different, well, then that creates errors, so prediction errors. And ultimately what we're seeking to do is to minimize that errors by, you can try and change the world if you want, good luck, or you can update your predictions to make better ones, more accurate ones. And that can go in both directions, of course, if you look at the work around addiction and such like. But that's the sort of the essence of it. So if you're in pain, then that's your body system's best guess. Now Mick and authors that he wrote with were talking about an ensemble of body systems, and I use that language quite often. So your immune system, your endocrine system, your autonomic nervous system, but working together. This sort of textbook idea of separate chapters and all this. That's not how it works, obviously. So they work like an orchestra, generating these experiences, all experiences, not just pain. And And so that sort of ties in a bit with the chicken pie and the cake. What are the conditions? What are the conditions here? If I'm feeling pain right now, I come to know that my systems are generating that as a best guess. I've had this pain for many years. I know that there's nothing tissue-based to it because I've had all the tests and all those things, although I might still suspect it slightly. Some people still hold on to that belief because it's a sticky one. But once you get beyond that and see the bigger picture of yourself and the world and your life, okay, what are my needs here? What is the shift that this pain is asking me to make? How am I looking after myself? Am I meeting my needs? Am I working towards my goals? What's going on here?
I use this idea of errors quite often when I'm supporting someone's recovery around this, the fact that the prediction is there to drive a response, a protective response. But if we then believe together that actually that's not a true representation of what's happening, then how about we don't fully listen to that and we create the error in the system? Let's say it's bending, for example. You decide to bend and you feel and experience that pain, but then you monitor and you notice actually nothing's really changed here. So then you can be more conscious and aware that actually that pain response wasn't necessarily accurate and correct for you. It wasn't protecting against anything dangerous. And then you can build upon that and you create these errors within this automatic system that start to reprogram. And that can quite often be effective for people, using this concept of errors to reprogram a faulty, overprotective system.
Yeah. And that sort of gives someone an idea of what they're doing and why, and helps them to engage. I've sort of often questioned this idea of the sensitized system. Undoubtedly, it's a state. It's a change in biology. I just wonder sometimes how useful it is saying to someone that they're sensitive or oversensitive and that kind of thing. I question everything I think about and do, as you know. One of the things I question quite strongly is this idea of it being maladaptive, chronic pain being maladaptive, that like the wiring's gone wrong and all this sort of stuff. I'm like, well, okay, with hundreds of millions of people struggling with chronic pain across the globe, have all their systems gone wrong? Really? I mean, that just makes no sense whatsoever. However, if you take the bigger picture and realise that the pain isn't just about the bit that hurts, it's about the person in their lived world, now it starts to make sense, even if it is something fairly specific like bending. Because when they bend, there are certain expectations. So that pain they feel when they're bending has largely been predicted even before they've done it, if they're still running the same program. So what we're looking to do, what you described there, was, we're looking to change that program. We're updating the beliefs, we're updating the expectations through experience, but also how we prime and through understanding. So, we're changing the way the systems are generating experiences, and people can do that. And that seems to be one of the keys for being healthy and being well, is this ability, this flexibility in the system to update.
Once you've primed and you've got someone thinking differently and you've got someone aware that there's another way of framing it, what are some typical hurdles that you might come across and some barriers? Because I believe now that healthcare professionals and physios that know even a little bit about it, they're starting to get more comfortable about talking this language and starting to have this conversation a little, but it could be derailed real fast if that first conversation doesn't lead to it, or there's a flare up, for example, that it hasn't quite gone well. So what kind of barriers are typical within these cases, and how do you navigate those?
Yeah, I mean, the barriers it could be any number of different things. Ultimately, it's very individual. It could just be some rigid belief that no, I need this first, or I need some interventions first, or you've given me some things, I need to now practice them, and then they haven't realised, well, actually they're not really practicing them, or I just need time. Okay, well, what? And there's ambivalence. So people don't always realise what their barriers are. And I suppose nowadays, when that comes up, I go back to him and say, well, have you thought about this? Have you thought that rather than, perhaps delaying when we meet next, we meet next to look at why you're delaying it. What's coming up for you there? Or I haven't really been practicing. Can we let's leave it some time until I've practiced. Okay, well, we can do that, or we can look at why you're not practicing. Do you think you're going to change anything between now and then? Because the vast majority of the time they don't. They just, next time we catch up, they still haven't really been doing it. They've just not been doing it now for a month rather than a few weeks or whatever. So this is why I think the coaching model is so strong, because you are addressing the reasons why. If you think that the exercises, the practices, the skills, the tools are all the tip of the iceberg, but we look at the whole iceberg. Because if you don't, and if you're just taking it on that tip of the iceberg level, then you're just not going to get anywhere.
The iceberg inevitably will end up with getting hit at some point. There will ultimately be a flare up. How do you help someone navigate the flare up?
Yeah,
avoid the fate of the Titanic?
Flare ups are great. There's do you remember the original Ghostbusters film?
I haven't watched it.
Oh, okay.
Weirdly, probably one of the only people.
Okay. There's this scene early on in the film where they've got their packs and they're going around this hotel to catch this green ghost. I can't remember what it's called. And they're all in different parts of the building and they're on their radios. And I think it's Venkman who essentially is in a corridor and it comes towards him and it slimes him and he's sort of left sprawling on the floor covered in slime. And Dan Aykroyd's character comes rushing up and sees him in this state, and he's lying there going, "Oh, I've just been slimed," or whatever the word is. And Dan Aykroyd's response is great. And that's always stuck with me, because when people say they've had a flare up, I mean, first of all, I encourage them to use different language around that. But I don't always.
What language might you prompt?
Learning opportunity, growth.
Yeah.
It's inevitable. It's part of it. It's part of the journey. It's normal. You don't want to make it into something it isn't. And I think there's a lot of fear and trepidation, there's a lot of avoidance. I don't want to flare up. I better not do this, better not do that. The complete opposite of the what can I do, and then having the skills and the principles to follow to work within the window of tolerance and to work with that. Clearly, I don't always plow in with great, but it's a massive opportunity to look at what's happening, to look at what's not working. What got you here won't get you there. I mean, it's a really important insight that people get. They get that. If you keep doing the same kinds of things, you're going to get the same kinds of responses. What do you want as an outcome here? What's your picture of success? And by the way, once you've really clarified your picture of success, forget it. Be here now. Set your goals, then forget them. Just make sure you're pointing in the right direction. And you'll have to frequently check your direction. And there's ways of doing that. Lots of different sort of check-in tools and skills that people can use. There's a lovely story which sort of illustrates that point, because a lot of people are putting a lot of energy in, but in the wrong direction. They're trying really hard. And I emphasize that point, that I truly believe that everyone is doing the best they can with what they have. That's the start point. They may not be getting the results they want. It doesn't mean what they're doing is necessarily wrong. They're just not getting what they want. And that's an important insight, because life isn't about what we want. And it quite often doesn't turn up how we want. We can have preferences. If you shift from want to preference, what a relief that is. Because if I just want things a particular way, or I want something that's different to now, root cause of suffering. And what does that do to pain? Well, most likely is going to make it worse. But there was a guy travelled to southern India to go to the I.C.A.M yoga centre, and he turned up in the village and he wasn't sure where to go. So he asked a local boy, where's the yoga centre? And the boy said, oh, well, it's 24,996 miles that way. And the guy's like, what? And then the boy said, but if you turn around and go that way, it's 4 miles. I love that story because it's very clear what it means, by and large. Where are you going to put your energy here? Because you could be going round 24,996 miles, and then if you're still facing the wrong direction, you're just going to keep doing it. Keep doing it, keep doing it. What got you here won't get you there.
Same goal, different direction.
Yeah. And you just need to reflect and look at what you're doing often. And I call them reflection sessions. Sometimes I'm literally with someone for the whole session and we're reflecting because they're pointing in the wrong direction. Their focus, what you focus on, your energy is going to flow that way. Your efforts are going to flow that way. So if you're focusing in the wrong direction, you're going to be using a lot of energy and you're certainly not going to achieve any of your preferences, or you're not going in the right direction, basically.
I use the phrase leap of faith a lot because I recognise that a lot of people have got to take a chance of something that doesn't always immediately feel like the right thing to do. They've got to leap in a different direction to where they have been.
Yeah.
And it's something that requires a lot of trust. It requires someone to really believe in me and believe in the situation.
Yeah.
And it comes back to that communication again. You have to build that rapport with someone. You have to be able to talk about leaps of faith and them to say, yes, okay.
Yeah.
I don't think there's necessarily anything super special about what I ask people to do, but I think there is a way that I ask, a way that I am. Coming back to your earlier conversation, how do you show up in these sessions?
Yeah.
And once you've built that trust, you can normally get away with saying to someone, great, you're covered in slime. You can get away with it because they're willing to go with that. They're willing to roll with the punches. So what other strategies or what other important parts of building rapport would you consider within your sessions?
Yeah, it's interesting because we use that phrase a lot, building rapport, building trust, and I've probably used it, I may have even used it in this conversation. I can't remember, but actually I don't see it that way. I see it as just being present, and it comes from that. Not everyone is necessarily comfortable with the idea that you give off a vibe, but you do. If you're not comfortable with that idea, you're just ignorant to it. And I don't mean that in a an offensive way. Ignorance in Buddhism means not understanding. So building that awareness and self-awareness is absolutely key. Being in the room with someone. I was talking at a conference a few weeks ago, and as you know, because we've chatted about this, I don't want to sort of give it away too much, but I often start by saying, look, this might seem a bit chaotic, this session, like I haven't planned anything, but the reality is you're never going to know whether I planned it like this and wrote it like this or not. And in a way, I nicked it a little bit from Stuart Lee, the comedian. I like his sort of style. But we meandered our way through these various things that I thought were important to discuss and talk about in a dialogue with the crowd, with the audience, the participants, I call them. And when we got towards the end, I encouraged them to think about their own philosophy. I gave them a few minutes just to think about it and write some stuff down. And it was interesting because I watched the room carefully as I'm doing my thing. And some people love that. They're like, yeah, and they start writing stuff down and you can see people really thinking about it. And others you can see, right, they're going straight onto Facebook or emailing someone. They're not comfortable with it at all. Which is always interesting. You think, okay, are you in the right game? I mean that. Because you need to know your philosophy. Because if you don't, you're being driven by it and you don't know where you're going. So anyway, that aside, people sort of shared their ideas, and I said, well, look, I'm always happy to share, my sort of philosophy. And I said, well, it's just one word. And I offered it out. So what do you think it is? And the guy from the back shouted out, and he was right. It's love. Now, again, that's not something that everybody's comfortable with in terms of what's that got to do with healthcare. I said, well, I think that we should strive to be loving what we're doing and loving the people that we're working with, because that puts you in the right space. But then you've got to have a fundamental understanding of what we're talking about in terms of love. because people will have automatic sort of responses to that and what they think I'm meaning. But it's not so unusual. I don't know if you ever listened to Pete Carroll talking, the coach in America. He talks the same kind of language. It doesn't mean that you're there with someone telling them that you love them. It's not that. It just comes through in your being. And if people are familiar with someone like Ram Dass, who was originally Richard Alpert, professor of psychology, who became Ram Dass, servant of God, he talked about being love. Be love. Because it opens you up to everything. And people will get that. They'll feel it. And you'll know they're feeling it because it's very clear in the room. And I know some people might resonate. For others might say, oh, this sounds a bit weird and alternative. There's nothing weird and alternative about love when you really look at it. And that's when you can go, great. Or a whole host of other things.
Another pain coach who's my colleague, Simon Cabot, he also works very much in this chronic pain world. He talks about love-based emotions and fear-based emotions all the time, and he's delved deeper into what some of those might be and how you use and leverage some of those for your advantage. And I just get the sense that the modern world is taking away from those love-based emotions on average. I just get the sense it's becoming harder for people to do it. But I also sense that young people are appreciating the importance of it. So although the digitization is changed things for sure, we spoke about it around communication earlier, but I think it did make it harder to truly express and feel and be around people. But I also do feel a shift is happening, people are more comfortable talking about their feelings as well. So there's almost like a dichotomy going on there, this paradox of their, perhaps as things get taken away, there's this desire to move towards it. And I sense that there is hope for our world as we move forward. So I sense that people do crave it, and I'm not squirmish around that word love. I think I know what you mean by it. It's not meant in the romantic world. It's not meant in any kind of woo-woo world. It's just a state. Like a state of love and appreciation and desire and care. I really resonate with the word compassion, and I think that very much is a love-based emotion. Compassion really makes sense to me as a driving force for doing what I do.
Yeah.
And it can really, with people that we work with, there's a huge amount of fear-based emotion that often keeps them stuck. And it's that love that can take them out of it. It's the opposite of that, I believe. And as I've been, as I feel like I'm learning from people like yourself and my colleague Simon Cabot, that once we do start to delve into emotion, we can have a bigger impact.
Yeah,
we can have better conversations with people.
Yeah, definitely. When you, and it probably takes time, and it depends on your background, but just being able to sit with someone who's suffering, you don't have to say anything. Just sit with them, and wishing them well. So it might be a meta practice that you've just got running, just while you're there. You're not then feeding into the fear or feeding awkwardness into that, which happens. You may think that your thoughts are private, and they are, but you are giving off an energy in what you do. So learning to sit with that is key. If you choose to work with people who, are suffering in the way, we're talking about, with particularly persistent pain, chronic pain, and for a whole bunch of other reasons, but it's kind of the ongoing scenario. You have to be so comfortable that you're not even there. There cannot be the self, because that immediately gets in the way. And the acceptance of someone, but particularly their acceptance of themselves, is the beginning of healing. I mean, that's very Rogers, but you see it. You see it, and our job in that way is to facilitate that. And I know some people, are working with someone who's twice this week said to me, "You're a psychologist?" I go, "No." Well, I've done a fair bit of training in different things, but I'm not a psychologist. Just listening to you really. I don't separate the physical and the mental. I think that division is not the reality. And I think that what happens there is you've got two parallel lines, like tram lines, that never come together. So it's always going to be an issue. We have to see the whole person and sit with that and sit with what is happening. And if you can do that with love, loving kindness, a simple practice that people can try, which is an interesting one, particularly if you walking down a busy street in a rush, great time to practice. Every time you walk past someone, you look at them, you don't have to say it out loud, that, you might get some funny looks, but just yourself, just wish them well. And in particular, if someone walks in front of you, or if they're walking slowly, or if they're on their mobile phone and they're coming right towards you, great to practice that. It's a great little practice. And see how your view of the world changes. Essentially, you're updating your belief system. If you update your belief system and come more and more through the lens of gratitude and compassion, these are not trite things. They literally change the world that you see.
You said earlier that you strongly believe that everyone is doing the best they can based on what they have available.
Yeah.
And it's rooted in compassion, gratitude, and love, actually.
Yeah. And some people will really teach you that, and it'll be hard. It'll be really hard, particularly in, perhaps more personal life, when things happen that are unexpected, or things that you don't want, or, really difficult, traumatic things. It really tests you on that, but you can grow from it. And I think that, comes in. There's lots of people who I've worked with as colleagues and whatnot who have been through extremely difficult things themselves and then become therapists of all sorts. And they are often excellent at really just sitting with someone because they know what it can be like. They don't know what it's like to be them because we're all unique. But that accurate empathy, that ability to be there and to connect and create that caring crucible is on another level.
Pain can be a wonderful teacher for some people. And I think that's what you're getting at there, is that some people can emerge from that and develop into something they perhaps never thought they could.
Yeah.
Experience.
Yeah. No, and I do a lot of work with people who have had, bad accidents and things. So they're in a process, and there's lots of moving parts. The process itself is pretty stressful, very stressful often, and it goes on for a very long time often because the system, the way it works, which desperately needs updating. But quite a few of those people will say to me at some point something along those lines, that obviously they didn't want that thing to happen, but it did. And this is a really important learning actually for all of us, that what has happened, and it couldn't have happened any other way because it didn't. And I've nicked that from Peter Crone, who I like. And that coming to know that is such a powerful position, because it releases you from the past and allows you to be present, and only by being present are the possibilities available. So again, you can get that from someone through these conversations. You can realize how open they are to possibilities, and that if they're not, that they're still living, or they're assuming the future is going to be based on what's already happened. And lots of people are stuck with that. I don't want to keep doing that thing, or I don't want to do that because it's just going to be the same. That when you deconstruct it and look at it more carefully, you realize that it's always based on false assumptions and sticky beliefs that need updating. Because once those beliefs are updated, and that future is not going to be the same as the past, because now you're present and you're the curator and the creator. But you won't know that until you're in that position. So part of the guidance is helping people, guiding them to that position. Then they realize it themselves. That's so powerful when they realize it. They only realize it themselves. I can't realize it for them.
Seems a nice moment to start wrapping up here. And something I use in my consultations, I'll check, is there anything else? Have I missed anything? Have we missed anything?
Oh, millions of things. Yeah, millions of things. Yeah. I mean, pain is so complex in the fact that it just stretches across every field. It's entwined in so many ways with lots of different things. But then so is love. You know, they're probably two of the greatest examples of conscious experiences that we have. So I think that we, as much as, you know, pain needs to be studied and the science of pain needs to be studied and so on and so forth, not at the expense of the experience being studied and understood of the individual. And getting lost in the tech and the science can move you a long way away from the humanness of what's going on. And we need to keep a strong tether on that and keep encouraging, I think, clinicians and practitioners to keep the humanness, because I think it's through that most of the healing happens, if not all. You know, and some people might say, but what about, you know, the interventions and the, you know, the medication? They're important. They can be important, of course, and I'm not saying there's no role for it, but without knowledge, skills, and wisdom of how to do it in your life, it's going to be a difficult path. I mean, it's difficult anyway, but I don't think people are going to make much progress. Certainly not just being based on passive stuff. It's vast majority of living yourself better is in how you're doing it moment to moment, day to day, and we can really help people to do that.
It's powerful.
Yep.
And the tagline of this podcast has been rooted in my own understanding of my why, which is better never ends. What does that mean to you in your mind?
Yeah, I mean, I love that. It's great. And it's obviously something you use to keep going in the direction that you're going. It's sounds a bit like Kaizen, doesn't it?
Yeah.
And which amuses me in some ways, not your concept, either, just the Kaizen idea, because it sounds like some ancient philosophy. But my understanding is it came from the Toyota manufacturing, where they just wanted to look for continuous improvement. But who cares where it came from? It's a great idea, but it's more than an idea. It's a principle. It can be your philosophy. And I would encourage people, as I was saying earlier, to clarify what their philosophy is, and then think, well, does that work? Is there a better one? You can keep changing it. Why not? Find a better one. Keep growing. Know your strengths. Play to them. But look after yourself. There's not enough self-care in our work, because that's key for all the things that we've been talking about in terms of presence and approach, being love. You know, it's absolutely key.
And I've very much enjoyed this conversation. I'm sure those who have got this far also have. How does someone find out about you and your work, Richmond?
Well, that's the beauty of having a slightly unusual name. You can Google it. I've got a website. I'm on Instagram as Pain Coach. I post on there most days. There's usually some sort of thing, and then I write a post. I've got my Substack, Pain Talking, which people can subscribe to. I'm on LinkedIn if you want to link there. Yeah, they can find me. It's pretty easy to find me.
This actually just reminded me that the way I found out about you was many years ago. I was treating a patient at their work because I was an occupational health physio at that stage, and they had access to see me as much as they want. I think that's how it worked. But they were also seeing you for chronic pain, and that's how I found out that this type of physio existed. It was very early in my career, and they were a pretty complicated case, and I was probably scratching my head a lot, but you were clearly helping them quite significantly. So I'd looked you up at that point and thought, that's an interesting thing. That's an interesting profession, way of thinking. And I've been following you for a long time on Instagram, and I strongly recommend anyone who is interested to follow you, because you do put some thought-provoking things on there, and as we've already found out on your Substack, there's some good, interesting stuff there too. So I'd encourage any interested listeners to do just that. So feels like I've closed the loop, actually, because I opened it probably well over a decade ago, and now here we are having a great conversation. So thanks very much for coming in today.
No, it's a pleasure. It's great to chat. I love chatting about this stuff, so thank you.
Thanks for listening to today's podcast. This podcast is sponsored by Better, provider of health and wellness services in central London. We really believe that we can help people feel better and live better. You can book in for face-to-face services at any of our 3 London clinics. We have one in Marylebone, one in Soho, and one in the city. You can also follow us on Instagram at Better Never Ends, or head over to our website for more information about the clinics or the podcast at www.betterneverends.com.